A lot of people take speaking and swallowing for granted. It's something we do automatically without even thinking about it. So when we start to have trouble, it's hard to know what to do. I'm Kim Prosser, a speech pathologist here at Salina Regional Health Center.
We're going to be talking about speech therapy. So what does a speech therapist do and what type of patients do you see?
Well, as a speech language pathologist, or a speech therapist as we're more commonly known as, we do see a variety of patients for different reasons. I like to say we help them with shoulder up because we work on speech, language, swallowing, voice, cognition, and memory. We do see a lot of patients from like stroke or Parkinsons or head and neck cancer for swallowing, and also for like language and word finding. And if a patient has any concerns on any of those areas, they can talk to their doctor or visit our website for more information. But then they'll come in for an evaluation so we can determine if they can go home and do a home exercise program to get better.
What do you do for stroke patients?
So a lot of patients after they've had a stroke do have difficulty swallowing. So something as simple as taking a drink of water is now very difficult, or maybe they aren't able to chew up their foods to swallow them correctly or safely. So they'll come in for an evaluation, and then we can determine what safe diet they can have while we're strengthening their muscles to regain that swallow function back for them. They may also have some trouble with their word finding. So sometimes they know what they want to say, but the word becomes stuck. And they just need a little bit of help and therapy to help get those words come out more smoothly.
How do you do that with the stroke patient?
For swallowing, we focus on strengthening the oral, like the muscles in the mouth, and then the pharyngeal muscles, which are the muscles in the throat. As far as like the word finding, it's a lot of repetition. So we will have them show them pictures or give them categories to name. And if they become stuck, then we give them those little helps and hints to get over that hump so that word comes out better for them.
Do you give them some exercises to do at home as
Definitely.
well?
All of our patients get home exercise programs. So when they come in for therapy, we'll give them exercises to do at home and go over them so that makes it easier for them to know what to do when they get home so they can continue to practice and regain those skills at home as well.
I was really pretty fascinated about the Parkinsons, which you would not necessarily think it's something that speech therapy would be needed for, but why don't you talk about that?
Right, so with Parkinson's patients, their dopamine levels are affected, and that means the muscle movement like speaking and swallowing is affected. And some patients will even have trouble with like problem solving and cognition and memory. So what we have here at Salina Regional, which both our outpatient speech therapists are certified in, is called Speak Out. And that's a program that is 3 times a week for 3 to 4 weeks, and it's all about speaking with intent and deliberation. So with Parkinson's, their volume tends to decrease and have that flat effect. This is helping them increase that volume and have better articulation so that their family and friends can understand them better.
Thank you for watching. For more information, please visit the Speech Therapy tab under Services of srhc.com, like us on Facebook, follow us on Twitter and Instagram.